Hello, my name is Yejun Hong. I'm a medical student in the University of Calgary, and our team is here to explain COVID-19 and also its effects on the eyes. A lot of infectious pathogens can enter the eye and cause many different pathologies on various parts of the eyes. The eyes can suffer just like any other organs in the body, and COVID-19 is no exception to causing this injury to the light-perceiving organ. COVID-19 is an infectious disease that is caused by a new variant that's discovered in 2020 of the coronavirus, labeled COVID-19. Another name for this virus is SARS-CoV-2, and it belongs to the Coronaviridae virus family. This particular virus also has a protein envelope, and its genetic materials are composed of single-strand RNA. This COVID has been a cause of a prolonged global pandemic lasting around a year now, and this is thought to have been transmitted to humans from avian and mammalian reservoirs. COVID-19 can cause many distress and reactions in the eye. So let's look at a layer of the eye called the conjunctiva and sclera. So the sclera is the outermost layer of the globe. It would be the whites of the eyes that you normally see. And the cornea is a thin layer that overlies the sclera itself. As you can see in the diagram here, the conjunctiva is a very thin layer that borders the limbus and also exists on the inside of the eyelid. So it is a continuous layer that protects the eye. So the risk factors of COVID-19, this disease is more likely to spread easily if the people are in close and crowded setting, and especially if they're less than 2 meters apart. The COVID can spread through droplets and airborne transmission, and in minor cases through fomites in solid surfaces. High-risk occupation includes long-term care facilities where many people live together for a long time, and the population may be having weaker immune systems. Correctional facilities for similar reasons, shelters, group residences, and service-based careers. Yeah, the commonality here being crowded spaces. Individuals with disabilities who cannot access these informations, services, or facilities are of special risk as well. Recent travelers have a higher chance of contracting COVID-19 as well as spreading them to various regions. COVID-19, as mentioned before, is spread through contact and droplets. Airborne transmission can occur in aerosol generating procedures in medical facilities. Fomite transmission is also a possibility, as the virus can survive on certain surfaces for extended duration of time. Symptomatic transmission is most common, making people cough, and the droplets containing viral particles can easily spread through the air. Asymptomatic transmission is also still possible, and children are more likely to be asymptomatic than adults. Incubation time for COVID-19 is 4 to 5 days, and the peak viral shedding, which is an individual shedding the highest density of the viruses, would be around the time they experience the first symptoms. Up to 2 days before, and as late as 2 days after, they may shed the highest density of virus. And the viral shedding persists up to 4 to 6 weeks since the first symptoms. The signs and symptoms of COVID-19 are most importantly fever, dry cough, and fatigue. Sore throat, headaches, rashes and discoloration of extremities, as well as conjunctivitis are all also possible with COVID-19. Ophthalmic complications of COVID-19 in severe cases of the infection includes vasculopathy. So if you look through the patient's eye with a fundus exam, you may notice enlarged retinal vessels. The eyelids may be swollen and excessive tearing may form. Increased discharge from the conjunctiva and photosensitivity as the eyes and the uvea get inflamed are also a possibility. Complications in cases of severe COVID-19 can occur all over the body. So in the respiratory system, the patient may experience acute respiratory distress syndrome or hypoxemia in general. In the nervous system, loss of consciousness, lethargy, and irritability are all possible. In the GI tract, loss of appetite, nausea and vomiting, and diarrhea. Loss of taste and or smell is a unique feature for COVID-19 as well, but there is an absence of nasal congestion. Skin changes, so in toes, the patient may develop itchy and painful lesions. And in the hands as well. Differential diagnosis for symptoms of COVID would be seasonal influenza, human rhinovirus, human metapneumovirus, adenovirus, and respiratory syncytial virus. When you're seeing COVID patients or any patient suspected of infectious disease, make sure to gown up, contact and droplet precautions with gowns, gloves, mask, and eye shield. Ask the patient about recent travels, drug allergies, and recent contact. Ask about their B symptoms, which include fevers, weight loss, night sweats, chills, and inspect for any peripheral lesions, chemosis in the conjunctiva of the eye, and conjunctivitis. Do a precordial exam to make sure the cardiorespiratory system is healthy, and listen for lung sounds. So many swabs can be done to investigate for COVID-19 and to determine if the virus is in the patient's system. That includes nasopharyngeal swabs, oropharyngeal swabs, or the cultures can also be tested from the patient's saliva, stool, or urine. If a patient has COVID-19, the mainstay of the treatment is to self-isolate the patient, ask the patient to rest plenty, drink a lot of fluids, and keep up with the healthy balanced diet for proper immune response. Do not use hydroxychloroquine or Calitra like some people have been proposing. For severe disease, you can try dexamethasone or remdesivir, and also treat secondary pneumonia that develops from the COVID-19. Currently, the vaccines and treatments are rolling out, and hopefully everyone can receive the vaccines in due time. The international fatality rate of COVID-19 is 0.35%, and this varies significantly according to the regions and countries. So here is a summary of everything we talked about regarding COVID-19 and a few slides about its relations with the eyes. And here is a reference from which we pull our information. Thank you for watching this video.